With the COVID pandemic, there's been a big increase in demand for palliative care in Kansas City and across the country. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week we're talking about how palliative care has played an important role in treating COVID-19 and how the pandemic has changed the field. With me today is Dr. Rhonda Goff, the Palliative and Hospice Director for St. Luke's Health System. Thank you so much for joining us.
Thank you, Lindsay.
So, Dr. Goff, first of all, can you just explain what is palliative care?
Palliative care is a specialty area of medicine that helps to focus on patients, focus on their needs, focus on their symptoms related to chronic or serious illnesses. It's provided by a team of medical specialists, physicians, nurse practitioners, nurses, social workers, and also spiritual care. So it's an interdisciplinary team. And it's often provided when a patient is looking to continue services with their own primary physician. Palliative care becomes a supportive connection to helping patients through this chronic serious illness to take them to the next level.
So why is it even more important now during the COVID pandemic?
Well, palliative medicine, by its very definition, is a serious illness. Many people come into the hospital, with symptoms that may lead them to needing life-saving treatments. Palliative medicine has the conversations with families and with patients about whether or not they need to be or would want to be on a ventilator, whether or not they would want to have a feeding tube, or all of the many medications and IVs that a person would need in order to try to save a life. We talk with them about, what it is that patient would want. If they were able to sit up in the room and we asked, what would your father want us to do? Many times the answer is often surprising. But we're here to honor the patient's wishes and goals, no matter what those are, and lead them on whatever path or journey they think is most important.
Now, a lot of people associate palliative care with hospice. Can you tell me how the two differ?
Oh, to me, that's easy. Palliative care is really about the living, people who are living with chronic and serious illnesses who are still looking for treatment, whether that's curative or whether that's something that will help prolong their life. And palliative care helps people have a quality of life, which is much different than hospice. Hospice is really more focused on terminal illness, patients who are maybe not interested in having treatments to help them with their serious illness, or maybe they're at a point where they cannot receive treatment for their illness. And it's really about focusing on comfort for the patient and for the family. Most times it allows them to stay at home and be with their family for whatever time they have left.
So there are many different specialists that have a role in treating the severely ill COVID patients. How does a palliative specialty really help those patients with the many challenges they face?
Palliative medicine is a specialty, again, that helps people. First of all, we look at the whole patient, as I said before. We are focused on three basic things, which is what I explain to my patients when they ask me what is palliative care. First of all, we're going to care. We're going to care for their symptoms. Most times we see patients in the hospital who have very difficult symptoms. We can help them with those, and when I mention that to folks, they say, well, that's great because I have a lot of those. We also help to communicate. We're experts in communication. We have complex discussions with patients and families about their illness, often educating them, sometimes for the first time, about what their illness is and what trajectory they may be facing in the long term. So we also communicate with their many physicians, many people come into the hospital and have several physicians that focus on different parts of the body. We're the people who put it all together and help communicate that to the patient. We want to make sure that we're following their wishes and goals. So we ask them, to make sure that we're doing exactly what they want us to do and not doing things they don't want us to do. And then we communicate that to their many providers to help them understand where this patient is in this journey.
So how has the pandemic changed palliative care?
Well, the need for palliative care has grown greater than ever before. Last week, we hit an all-time record on the patients that we were seeing in the hospital throughout the entire St. Luke's health system. COVID patients have added to our numbers like never before. Since we're experts in communication, we often do a little more. We connect with the families. We help support the staff by giving them extra time while we connect with the families to make sure that we're doing everything we can for the patient. We hold Zoom meetings, WebEx, sometimes telehealth visits, and also by phone, just to stay connected to the families so that they know what's happening. It's a very, very serious time in a person's illness, and it's difficult for families not to be there.
And it's also increased awareness of just how important palliative care is.
That's right. Palliative care has grown here at St. Luke's immensely over the past couple of years. We have teams at every hospital now, and we're helping to support more patients than ever before. Nationally, palliative care has grown, and the pandemic, unfortunately, has shown a big light on how palliative care can be involved with patients and families and help them through these serious times.
So how can patients and families get palliative care as a part of their treatment?
Palliative care, as a patient comes in, with a serious COVID symptoms, comes into the hospital. Palliative can be ordered by the physician so that they have a support connection. If patients have been coming into the emergency room, have other chronic diseases, they're most likely going to be more intensely ill. And palliative care should be attached as a specialty provider to those patients for that support system so that we can join them on that journey, no matter where that journey goes. A national survey really shined a light on palliative medicine. When people know what palliative medicine is and they know what kind of benefit it can provide, 92% of people surveyed said that they would want palliative medicine for themselves or for their loved ones.
Okay. Well, thank you so much for joining us today, Dr. Goff.
Thank you. Thanks for having me.
To learn more about palliative care at St. Luke's, visit stlukeskc.org/palliative. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.